Hello again. I have a video today that talks about drugs, foods, and vitamins that don't mix. They're dangerous combos that avoid at all cost. Dr. Whitaker is behind this study, provides this information. He's been a prescriber of medicines, vitamins, minerals, all kinds of things since 1969. Well respected in the industry. I've used his vitamins and minerals for a long period of time and have nothing but good things to say about it. It says here that 3 out of 5 Americans aged 20 and older take at least one prescription drug. And this is a dramatic increase since just the year 2000. Polypharmacy. And what is that? Well, it's really a number of adults taking 5 or more medications during the same period of time. 36% of the people ages 62 to 85 are victims of polypharmacy, and many of them are on medication that are inappropriate for their age group. So you need to understand what's good, what's bad, and do some research. Find some people, some doctors who are knowledgeable in these. And if you've done any kind of talking with your current doctor at all, you likely got some kind of a comment from them, he or she, that, well, I don't know you should even be taking vitamins and minerals, or they don't do much for you, or something like that. Well, I can't speak for all of them, and I don't want to try, but I do know for a fact that some of them just do not know anything, have done any research, don't know anything about these, and so they're offering information that just outside their scope of authority. Now, if they're a doctor and they've been dealing with medicines and different kinds of drugs, likely they know what they're doing. But vitamins and minerals and interaction and maybe some foods, no, probably not. Did you know the interaction between blood thinner, commonly called warfarin, and vitamin K are well documented? Vitamin K is an integral vitamin for normal blood clotting, and it can reverse anticoagulant activities of the warfarin, making drugs less effective. So if you're taking warfarin for blood thinner and also taking vitamin K, and you need to find out what foods gives you vitamin K as well. I did that in one of my last videos. You may want to go back to that one. I don't want to get back into all the details each and every time. But if you are eating some of those foods or considering a vitamin K and you're on warfarin, blood thinner, probably shouldn't do it. Second potential nutrient-drug interaction that can occur when you have certain antibiotics taken with minerals. There's a lot of minerals. Tetracycline. There's different kinds of those, and they're high-powered. They prevent the drug from being absorbed that are given to you for antibiotics. And calcium is the most likely mineral to be problematic. In fact, tetracycline usually comes from a warning on the label not to take it with milk or daily dairy products. So calcium can interfere with the things that you may be taking for antibiotics. And if you are prescribed for an antibiotic for some kind of an infection or something like that, kind of watch the interaction of some of these things. Then there's a amino acid called L-arginine, A-R-G-I-N-I-N-E. It's primarily a nitro oxide, and it has been known to be in interaction with a lot of medications. It's powerful. It means it can relax the arteries. Now, we all need nitrooxygen in our bloodstream. And sometimes we're prescribed, sometimes we take more as a vitamin or a mineral, actually. But we need to understand that there are some side effects, and that if you've been recommended supplement L-arginine for enhanced vascular health, improving blood flow, or even boosting sexual function, then there can be some problems with interaction with some other medications. For an example, it shouldn't be used by anyone taking Viagra or other erectile dysfunction drugs. And there's others too, and so you just need to be aware of that. So there's drugs all that can deplete vital nutrients. Scarcely a day goes by when a new drug isn't heralded in the press as its potential to eliminate arthritis pain, relieve depression, or prevent heart attacks, or whatever. Well, a lot of these can deplete your nutrients that are needed, and you need to do some understanding. Yet supplement manufacturers cannot even tell you what their products do without prior approval from the FDA. And sometimes the FDA is backlogged, takes a long time for them to get to it, or occasionally they do something that might be wrong. They're a human group, after all. Another one that I'm quite familiar with is if you're taking a statin for lowering your cholesterol, and I have for a while. My cholesterol has really been good recently. Might even consider getting off of it, but for now I've continued with it. But one of the things that will prevent your statin drug from lowering your cholesterol is if you do not have enough coenzyme Q10 in your bloodstream. Now, what does that do? Well, depletion of it can cause serious side effects ranging from muscle pain, weakness, disturbances, and ironically, heart failure. And one of the reasons you're taking cholesterol medicine is to help your hearts, isn't it? Well, the point is, if you're taking a statin, cholesterol reducing drug, you should always take a CoQ10, coenzyme Q10, and that will help balance the two. Then there's acid blockers that impair absorption and causes you problems. And you need to understand some of these acid blockers. A lot of them have different names, and we can't go through them all, but what these blockers, well, a couple of them, I'll just give you their initials. It's PPIS, little s, and an H2 blocker. And they increase the risk of vitamin B12 deficiency, especially in older people like me. Drugs especially more potent in PPI are iron, magnesium, calcium, zinc, folic acid. So if you're taking these and you're on a blocker, you're at risk of having a vitamin B12 deficiency. And that's pretty important. You need to go back to my vitamin video, and you'll see why it's really important. Well, there's some nutrient-robbing diabetes drugs too. Metformin is the most popular oral drug for treating type 2 diabetes. Sometimes you get insulin, sometimes you get a pill or something like that, but they lower your blood sugar. However, metformin has a serious side effect. It dramatically lowers, again, vitamin B12. Huh. Funny, a lot of things attack B12. Also, they adversely affect folic acid, vitamin D10, and maybe some others. And so you need to understand that there's some times when, if you're getting a diet rich in all your foods, vitamins and minerals, which is likely not going to happen because of your fast food from time to time, but even if you did, and you take some of these other drugs, you're robbing yourself of some of the key ingredients necessary for maintaining a good, well-balanced blood flow, diabetes 2, lower cholesterol, whatever the case may be, a lot of these things. Well, I can go through a lot of these, and I think that one of the things that you might want to consider doing is find Dr. Julian Whitaker, MD, and ask him for some of his research documents. He's been certified by the Food and Drug. He has a Healthy Direction website that you might go to and find out a lot more, or find out if you can get some studies. Some of them are free. Some of them are free when you purchase a vitamin or supplement or something, and you can do that maybe with just a 30-day trial or something like that. It'll cost you a little something, but if you just listen to some of the things I just told you, you might have picked up one or two that you need to consider right away. But rather than counting on all of that, there is a chart in this booklet. I want to go through some basics, kind of close out this video for you. There are some other nutrient deficiencies, and I'm going to give you, there's like 15 of them here. Can't give you all 15. A couple of them I've already given you. But if you have an ACE inhibitor, what's an ACE inhibitor? Typically for heart attack issues or heart problems. The nutrients that are depleted are zinc and sodium. Already have given you some of the things on antibiotics, given you some on beta blockers, like the CoQ10, folic acid, and vitamin B12. And if you take birth control pills, ladies, they will rob you of vitamin B12, folic acid, zinc, and selenium. Selenium is pretty important. There's not a lot of foods you get that in. And I mentioned calcium channel blockers. That drug sometimes is needed, but it depletes your potassium. Potassium is a mineral that can cause dehydration and cause you to faint and have heart attack symptoms, and maybe even give you problems in the future. But you need to be aware of that. And then estrogen. Again, primarily for the ladies. If you're taking estrogen or Premarin or Prempro, vitamin B6 can be depleted. And then if you have NSAIDs, ibuprofen, naproxen, some of those, you know what ibuprofen is. Well, that eliminates or depletes folic acid and vitamin C. Very important. Talked about statins and your coenzyme 10. Give you one more. Thyroid replacement. heard a lot of people saying they've had thyroid problems and they've had to take something for it. That can deplete your calcium. Now, calcium can be a vitamin mineral that, taken in too big a supply, can cause trouble. So you need to be aware what the normal doses are. And again, I gave you a video not long ago that talks about these things. It's from Johns Hopkins, vitamins, minerals, and a few other things. You might go back and review that one. Or find a source like Julian Whitaker. He can tell you what's going on. Well, a lot of herbs have medicinal effects. Some of the herbs are pretty important. Some of them are not. Some of the herbs you just can't take, especially if you're being treated for things like chemo or radiation or whatever. You need to be careful of some of the minerals or actually herbs that can cause problems. One of the herbs that you probably shouldn't take at all is the St. John's wort. It's considered safe when taken alone, but the benefits may be to help lower blood levels of oral contraceptives. But that can be a problem if you want the contraceptives to do the job, right? Yeah. Well, anyway, St. John's wort is typically not one that is touted as having a lot of good things. But look it up and see, do some more research. Here's one you probably didn't even know about. I didn't. Years ago, when I started taking some things, I had a little bit of reaction, not much, but it was a little bit, and I couldn't figure out what it was. Well, I really liked grapefruit, and I would eat grapefruit, cut one open and have one, 2 or 3 times a week maybe, not every day. And I was taking it with some other medications. Probably when I first started taking cholesterol medicine. I don't know for sure if that was. It's been such a long time ago. But grapefruit juice interacts adversely with dozens of medications. It causes all kinds of problems. Even as little as a whole grapefruit or 6 to 7 ounce glass of juice is enough to cause problems with drug toxicity. And some of the problems that they can cause, it's a partial list of some of them. It can cause some problems with your anti-anxiety drugs. I know some people who take anxiety drugs, antidepressant drugs, antihistamines, calcium channel blockers, we talked about that one, erectile dysfunction drugs, methadone, statins, HIV medication. All of these can be affected by intake of grapefruit. All of them, not necessarily. Just like most things in life, not everybody is affected the same way. And that's why when you hear somebody say, oh, well, I don't need these, I'm just going to whatever. If you don't know what some of these drugs and foods and interactions are, you need to understand them and do some research from some places that are really good. Now, we're in a time right now of a virus. Now, what was the real cause of this virus? Was it man-made in a test? Did it come from some ill-natural source that just escaped someplace? There's different opinions on that. But the point is, there are a lot of things that over the years that we found drug reactions, maybe some shots, things that will get rid of them. But we've also found some things in the study that some of these drugs and foods or other kinds of things interact with the medicines we've been prescribed, or the vitamins and the minerals that are important, because sometimes we're depleted in these things. And if we just go along willy-nilly thinking, yeah, we're all right, we may find out one of these days that we could have done something to live another 5, 10, 20 years longer maybe. If you watched any of my videos recently, you know, I've just admitted my first few videos on my Facebook, I didn't talk about it because it wasn't important. But it has been recently, because for 79 years, I didn't have hardly any real health issues at all. But just recently, I did have a mass on my pancreas, and I had to have it removed. And they took a little bit of the intestine, a little bit of the liver, and a little bit of the pancreas, and essentially put it back together. It's called a Whipple. And I had 32 staples, and it was cancerous. I've been treated with 10 chemo infusions over the last 22 weeks. There's no sign of cancer right now. I'm 80 years old. If I said before, I say it again. Hope you look at me and you say, he didn't look 80. But for the first 79 years, okay, part of mine was attributed to my hereditary, but my dad, he passed away at 62, heart attack. When I was prepared for my surgery in July of this past year, they found I had a marvelous heart, no blood clots. EKG was really good, all kinds of really good things. And that's what got me through these chemos so good. I hardly had any problem with chemo. Okay, I was a little weak, still am, and use a cane occasionally to get around and do some walks. But it's important that you study some things that are important to you. I started vitamins 40 years ago. And for all that period of time, I took vitamin minerals. And it was important that I understood what they were. And I would take 2, 3, sometimes 4 or 5 sources, and not just one. And I would make sure that they were all saying basically the same thing before I would indulge. Well, I can tell you, Julian Whitaker is one that you can count on. And I would recommend going to him and getting some information. I'm not recommending vitamins and minerals from him. That's your business. I don't get any benefit from monetary benefit from him selling anything. I do get some health benefits from some of his products. That's worth it to me. Well, thanks for watching. I hope this has been beneficial to you. And some of these things are watch outs that you will find that are important to you, that you will do some research in them. And as a Christian, well, you may not be, but as a Christian, I like to end my videos by saying, God bless you, and I hope you live to a ripe old age, and the Lord may be with you.